In the videos that you've seen on this channel, you've seen toenail trimming and callus trimming and removal of toenails, discussions about fungal nails and bunion and hammer toe surgery. But what we've never shown is what happens when the patient initially comes in for the first visit. So in this video, you'll see what a typical intake might be like and a little bit of the exam, not the whole thing, but this will show you a little bit of what happens before the scenes when you see me trimming toenails. Now, if you're not interested in this, you can jump ahead to about 7 minutes is where the action starts with the nail cutting. So go ahead, and if otherwise, you'll see that we're a very small clinic. I am my own scribe. Thank you, Mom, for making me take typing, now called keyboarding, in high school. But this is kind of the conversation that happens at the beginning. So I hope you enjoy it, and here's the video. Did this stop working, or did you just turn it?
Oh, I didn't plug it in.
Okay. Okay, so you're really well controlled then?
Yes.
Okay. And you have seen Dr. Kaiser?
Yes.
Okay. But they're not doing routine care anymore?
Correct.
Okay.
She used to see Dr. Did you know him at all?
One of my favorites, yes.
Oh, gosh, he was the first one that really helped her
Okay.
get rid of these
Ulcer.
Okay, so you have a history of an ulcer?
Yes.
Okay. Where is that? Under, okay. Yeah, it's too bad he retired, huh?
Yeah.
He's a good guy. I've known him since I started. He was one of my teachers in my residency.
Really?
Yeah. So, yeah, he's a funny guy.
Yes.
Yeah. Okay, so when was the last time that spot ulcerated?
I think it's ulcerated right now.
Okay, before this.
How long ago did we see Dr.?
Has it been 3 or 4 months?
Oh, okay. So,
Yeah, that we've seen Dr.
You said 6 weeks ago.
The last time we saw him.
but it was all healed
Yes.
at that point?
Yes.
Okay.
No, it wasn't healed at that point, doctor.
Okay.
So Dr. retired. Then we went to a doctor.
Okay, I know.
He's over at Midwest in that West Health too.
Okay.
Not a great fit. Can I say it that way?
Yeah.
That's perfect, yeah.
Then we went to Dr. But really liked him, but he doesn't do the total package.
Right, okay.
So that, I think we probably saw him, what do you think, a month ago the last time?
Yeah, January 7th, I believe.
Okay. And he treated the wound?
Yes.
Okay.
And then we got into you
Okay.
as soon as you were available. We probably should have gone back to him to cut it back again, but we didn't.
Okay.
We waited.
All right. Had you said I'm a diabetic and I think I have a wound under a callus, just for future reference, we probably would have put you in as an emergency.
Okay.
That word diabetes will open doors
Okay.
with medical. But okay, I mean, nothing looks like it's huge and blown up and infected, so we'll get to that.
It hurts to walk on it.
Yeah, I bet. Now, has anybody ever made you any special inserts to get the pressure off that? Okay. And how long ago was your last pair?
Over a year.
Okay. And do they still work pretty well?
Yes.
Okay.
But you think they're too big or not?
Well, yeah, they always order them too
Right
big
there.
for me.
Okay, do you have them with you?
Yeah, right down here.
Okay, we'll take a look at those when we're done.
And he offloaded it for this.
Mm-hmm. Right.
And that really helped.
Yep, that's exactly what I was getting at. Yep.
And tell her what Dr. had you in.
It's just a surgical boot, which really took the pressure off too.
Okay.
But gave her a pressure sore
But gave me pressure sore.
on the side of her.
Right up here.
Yeah, that looks nasty too.
Oh, okay. Was it a flat bottom shoe or was it like a walking cast?
Flat bottom shoe.
Okay. Okay. All right. Anything else you need me to know before I take a look at your feet?
Yes.
Yes.
Oh.
You need to tell her about the neuropathy.
Oh, my feet are pretty much dead, so
Mhm.
don't worry about hurting me.
And how far up do you think you have no feeling?
Up to my bottom
up to
of
the
my
knees. Okay. Okay. Yeah, that's the diabolical nature of diabetes. Is you're really well managed, and the stuff can happen anyway.
Right.
Any other complications? Any retinopathy or kidney issues or stomach issues from the diabetes?
I don't think were the kidney issues due to the diabetes.
Yes. But they were due to the acidosis. You had kidney.
Here.
Yeah, actually, I can feel it.
Okay, good. Now, if we go to the other side, how about up here? Do you
Yeah.
feel vibration?
Yeah, I have a lot of sensation there.
Okay, good. How about there?
I can feel a light rumble.
Okay, and how about here?
Nothing.
Okay. So I'm gonna do, you know that wire they test you with all the
Yes.
time? Okay, I'm gonna have you close your eyes, and I just want you to tell me if you feel me touching your foot anywhere. How about here?
No.
Nothing. Okay, here?
No.
And here?
No.
How about there?
No.
Anything here?
No.
Or here?
No.
Okay. So, yeah, you've got a lot of neuropathy. Good news is you've got really good circulation in your feet.
Oh, excellent.
Yeah, better than I would have thought. So what we'll do is, I'm gonna lift this up and tip you back a little bit. And we'll go ahead and we'll trim everything. And then what we'll do is then you'll have to move because we'll bring everything around here and we'll shoot that way. And I'll trim the calluses and make sure. I'm not convinced there's an open wound there, but we'll
Oh,
see.
you're not.
It doesn't, I mean, there might be. We'll see when we start to trim the skin off. So I'm just gonna go real gently. Is the light?
Yeah, it's fine.
Okay. So this is how we do it. Now, I know that you're young, are you on Medicare?
Yes.
Okay, so they will allow you to come in every 2 months for this? That's what you were doing with the other doctor, right?
Right.
Okay. And should there be a problem in between, you call up and you remind us, I'm diabetic, and I think I have a ingrown toenail or infection or anything like that, and we will get you in that day,
Wonderful.
as long as you don't call at 3:30.
Dr. Sperling, your fingers are just covering all the toes.
Sorry. Yeah, her toes are kind of bent over.
Exactly. Why are they bent over?
Why are they bent over? It's just
Is it
some
from a
loss of...
bunion?
You don't really have a bunion per se, but it's just how the muscles have pulled them kind of out of order.
Okay.
So I'm gonna just tip you back a little bit more. And that might make it a little easier to see. Okay. Anything hurting?
No.
Now, are you working at all?
No.
What do you do with your days besides doctor visits?
It's pretty much doctor visits.
I remember when I first started, one of my older patients told me, if it wasn't for all my doctor visits, I'd have no social life at all. And now I understand it. Did you have a profession before your diabetes got?
Yeah, I worked for a company called,
Okay.
and I was an accounts receivable coordinator. That was a long time ago. Then I got some mental health issues.
Okay. Happens to the best of us.
Yeah.
I am on a crusade to start having it called brain health instead of mental health, because mental health has judgment attached to it.
It does.
Don't you think?
Yes.
I think it should be called brain health. Okay. Now, did you talk with Dr. at all ever about this, about doing something with the bone there to help avoid that callus getting so bad?
Dr. actually mentioned that surgery,
Okay.
but he said I had faint pulses.
To me, your pulses are bounding. You know, maybe maybe you were a little dehydrated the day you met him, or your blood pressure was a little low or something, but to me, your pulses feel very strong.
Okay, and do you think Dr. would be the one to do it?
No, I mean, it's something I could definitely do, but
Oh.
you know what? I think let's get through a few more visits
Okay.
and see how we're managing. And then if we have to, we can talk about removing the pressure point.
Okay.
Was that the first time you've had a sore on that spot?
Yeah, we were working on this other one, and then one day I just said, oh, this spot occurred.
But I mean on that pressure sore on top there on the side.
Okay, so let's get these thinned out and then we'll do the callus. So that should feel a whole lot better.
Thank you.
And we have a wound here that we need to take care of, but
Great, that thing hurts so bad.
it really hurts.
Mm-hmm.
And you have no feeling in your feet, and it hurts.
It hurts.
Okay. So I'm gonna go slowly.
And you've had this for years.
Well, the callus, yeah.
And the sore. The sore when you were when you went to that doctor in Cambridge, didn't you do a graft on this sore?
That was on this.
Oh, it was on the other one.
Yeah.
So this is a new sore.
Yes.
Okay,
This is one that popped up right at the end of Dr.
that's true. I remember that. But doctor, and not to, I sound like to say this, he did it every week.
Right.
He cut it down every week
Right.
for a long time, and he was the first one that was able to actually get that healed.
Healed, yeah.
Yes.
And that's what you have to do.
Mhm.
You need wound care weekly when these things open. So this is not an open sore today.
It isn't, okay?
No, if it got much thicker, this area right here,
Uh-huh.
looks like it would have opened up. But right now it is not, so, phew.
Yeah.
So why does it hurt so bad? do you
Just because
think?
it's a super thick callus and you're putting a lot of pressure right on that bone there.
Right, I actually tilt off of the sole of my shoe.
Yeah, this also feels really soft and squishy here. So let me just take a little bit more and make sure.
Yeah. Because Dr. thought at first it wasn't, but then
He said it was.
he said it was, so we're not. But maybe we've been able to heal it by now.
Now, have you ever had surgery on this site?
Where the ulcer is?
Uh-huh.
No, never.
Okay. So I'm wondering if this area just being kind of inflamed, it almost feels like there's a bursa in there, which is like a little fluid-filled sac,
Okay.
not pus. You know, like you can get a hip bursitis, but this just feels, the word we use is fluctuant. There's fluid in there. We'll get an x-ray on your way out. I do not feel at all like this is infection or an abscess or pus, because it's not red, it's not draining. I think, and it's pretty well circumscribed right here. It just feels really squishy. So we'll get an x-ray just to make sure the bone looks okay. But I don't think that there's any infection there.
Okay.
And the wound does not look open to me.
Well, that's a relief.
Yeah, it
Yes.
is a relief.
I
very
mean,
much.
a couple more weeks and I can almost guarantee it would have been. But right now it's not. And so that's good. All right, now let's do this one
That one should be easy, just chop it off.
compared to the other.
Exactly.
You feel any of that? It's
No.
still pretty dead, huh?
Yes, I can feel the callus.
Yeah.
It kills me, but I can't feel anything on my feet.
Right, it really stinks, and you're not alone. That people have numb feet, and in your case, up to your knees. Yet you can still feel pain.
Right.
You know, why can't you feel the good stuff?
Right.
Okay. So these look good. Now, I want to take a look at what your orthotics look like in your shoes, and then
Okay.
we'll go from there.
Yes, 'cause I desperately need a new pair.
Okay. All right. Am I missing any? I'm going to leave this alone. All right. Well, thank you for letting us do the video.